Well, hello, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And tonight, I feel super honored and happy because I get to have a friend, a co-worker, I guess you could say, so to speak, co-volunteer. I volunteer with Cancer Care Services. Her name is Tamika Chambers. So Tamika is going to be talking about something special when it comes to healthcare advocacy. So Tamika, introduce yourself.
Hi, everyone. My name is Tamika Chambers. I am the financial advocate at Cancer Care Services. And I am originally from Pittsburgh, but living here in Fort Worth. And I enjoy helping my clients through financial advocacy.
That's awesome, because I was just talking to Tamika before we hit record that sometimes finances, when it comes to healthcare, is what I forget about. I'm so focused on the health aspect, and that's overwhelming enough. So it's great to know that there are other advocates out here that focus on different areas, because it takes a village. So Tamika, tell us a little bit about how you got started and a little bit about your journey to helping people with financial advocacy through Cancer Care.
Okay. So I worked in healthcare for about 20 years. Started out as a nursing assistant, didn't like that, went back to school to become a medical biller. And then I worked for a company for about 10 years on inpatient and outpatient claims. Also worked for CVS retail pharmacy, not retail, CVS specialty pharmacy, where I did all of their claims for them, insurance claims, and worked with a lot of doctors on medications that they needed. So after doing that, I worked as an insurance specialist, verifying all the benefits for the hospital, inpatient, outpatient, therapy, all of those things. I moved here to Texas, and this position came up, and I said, this fits my qualifications, fits my need, and also fits the ministry that I want to do within my life, and that's help people with their medical bills. So I got hired on that, and all the skills fit up correctly, and I've been there for about 3 years now. And it's actually turned into more of an education than just helping people with their bills. So
yes, ma'am, because education is key throughout. I mean, we never stop learning. There's always something to learn every day. So,
amen to that. So true.
So tell us a little bit about, the inner workings that you do for Cancer Care Services. What parts do you play in the healthcare advocacy?
So I call it a financial advocate. I really call it financial health literacy, because making sure to educate our clients about what health insurance is, how health insurance works, and also educating them how to read their bills, what programs are available to help those who are uninsured pay their medical bills, how to write financial hardship letters when they can't pay their bills. So it's a lot of education right now in helping them with that.
Oh my goodness, yes, because it can be very overwhelming, because sometimes, we throw out terms like EOB and things like that. And it's like, okay, wait a minute, is this a bill? What is this? Why am I getting this already? The things that we get in the mail after the procedure, doctor's visit.
Yes.
Yes. So you basically, oh my goodness, Tamika is so amazing, because she basically takes you from what is an EOB to what if you don't have insurance? I have so many questions that I want to hone in on. So let's go from the start. Like, say you got a client through Cancer Care Services and they have insurance and they're confused about their billing. We'll talk about that. And then scenario B will be a client who doesn't have insurance.
Okay. All right. So what happens is a referral will come in, our social workers will talk to the family or the client themselves and find out exactly what they need help with. So if they have insurance and they mention, I got all these bills, I just don't know what to do with them, they're referred to me. Once I talk to them, I try to just get, some understanding. I just don't go in and say, you have all these bills, let's just get through them. I try to get the backstory, try to really understand where they're coming from, how the bills accumulated, and then I'll have them come in, work with me if they can. If they can't, then we do everything, over the internet. or over phone, whatever's easier for them, because everybody, there's all those barriers that take place as well as transportation and things like that. So I try to work around all of that. I ask for their insurance card so that I can know what insurance they have, set up them an account online if they don't have one so that I can look up all of their medical bills and match them up with the ones that they gave me to make sure that they are billed correctly. I'll give them a plan of care sheet and an insurance verification sheet. And what that consists of, the insurance verification sheet has everything from their insurance plan, what type of insurance it has, where they need to call if they have any questions about their insurance, what their copays are, what their out-of-pocket is, how much they've met from their out-of-pocket. If they only have an in-network plan, I give them all of the details and the deeds on that. I'll also go in and download their plan of summary, because that's something that's really important that people don't know that they need to have so that they can understand their plan. And then I'll dig into the bills, start looking at each bill that they have line by line, making sure that it's billed correctly. They have a primary and a secondary insurance. Has that been done? If things have been adjusted off the bill. And then I'll go in that plan of care sheet, we'll write down this was billed correctly or this wasn't. We'll go into what the plan's going to be to try to get these billed correctly. If they weren't billed correctly, how to file an appeal.
Wow.
There's so many scenarios. That's just a straight to the point. This is what your insurance is. This is what we need to do. So if someone has insurance and say it wasn't billed correctly at all, then I'll and become their authorized representative. That's just somebody who can speak on their behalf according to HIPAA. And I'll go in and I'll talk to the insurance company and ask them, why these claims were denied, get the code for that denial, and then go in and try to get them reprocessed so that they're paid correctly. So it's a whole process. And then I'll sit down with the client and explain to them every step of what I did, how I did it, educate them on the codes and the reason why it was denied, why one bill wasn't paid, if it was paid, how it was paid correctly, match up the bills with the EOB or the explanation of benefits, and I'll prepare a folder for them and give it to them so they can take that home and have it. So that's the case if it's insurance and, that's just plain straight down the line. Other things happen along the way.
Yeah.
But if it's something, I know it's a lot, right?
Because, it's so much, because it's not just a one and done process. Yes. And then you have, I don't want to say it nicely, personalities to deal with the insurance companies. Absolutely.
Yeah. Absolutely. Like and I have to keep in mind when you run into these situations, my clients are sick, their families are dealing with things too. So do they really have time to call these insurance companies and go back and forth and talk to them about this has been billed, this hasn't been billed? Their main focus is making sure that their family member or themselves is taking treatment and making sure they're taking their medication and they're okay.
And that's so stressful. That adds to their illness, at the same time.
Yes.
If they're fortunate.
And what we call that is, no, go ahead.
I was going to say, if they're fortunate enough, my suggestion would be don't have one person do it all. My suggestion would be to say, okay, you're going to be over my healthcare portion to help me to navigate that. And somebody else is over the taking care of the billing, because that's a different ballgame.
It's a lot.
Yeah.
And if they have more than one insurance, if they, somebody doesn't understand the insurance that you're putting in charge of it. I mean, there's so many different factors, but you should have more than one person, and you should make sure that they have the time to set aside to deal with it.
Absolutely. Absolutely. So we were going to talk about our next scenario. Say you don't have insurance.
So if you don't have insurance, it's a whole different situation. So I'll still get the referral. I'll talk to the client, and I have to figure out, what their income is, what their financial situation is. Here in Texas, it's really hard to become eligible for Medicaid. So I'll have to find out if they're eligible for Medicaid, find out if they've applied for the health marketplace, if they understand the health marketplace, if somebody in their home already has insurance, and can they get on that plan, or what it would be, how much would it be for them to put a family member on the plan? If they're still under the age of 18, is that the right route to take? So we go through all of that. I'll educate them on insurance, and then we'll go through the whole application process together. So depending on what insurance they're going to apply for, sometimes it's just the breast and cervical cancer Medicaid that a lot of people don't know that they're eligible for. I've helped a lot of people apply for that. And if they just are not eligible for any type of insurance, then we'll start looking into financial assistance programs, copay assistance programs. We'll start talking about negotiating rates with the hospital, because a lot of people don't know a medical bill is not, secured credit. It's unsecured, so you can negotiate that. And you have to be, closed mouth does not get fed, is what I say all the time. You have to go in and talk to these departments and let them know, I don't have money to pay this bill. What can I do? What are my options? So we do that. I educate them on financial hardship letters and how to write one of those. So those are all the options for someone who is uninsured.
Wow. And it's so, what we talked about tonight is not even the tip of the iceberg of what you do. So do you have a team of individuals helping you? Because, I can't imagine the workload.
Not right now, but we're working on that. I'm right now in training for leadership to become the director of this particular department. So I will be adding someone else to help me out with that. We have a bilingual Spanish-speaking financial navigator, which that's a whole different topic of issues that come with that. So she is trained to deal with that culture and what they need. So hopefully it's me.
Yeah. Well, you do an amazing job. I know that, and you're so well versed in this arena. It's just like amazing. I learn something every time I talk to you. Yes, because it's just a bunch. When someone is going through something, especially cancer or something that's just as devastating as anything, and they're lost. Where do I start first? Now the medical bills are coming in. Now what do I do? That's causing me even more stress. So it would be great to be able to reach out to you, especially if you're, so do you have to be, I heard you say referred by a social worker.
Correct.
These people are already in the program at Cancer Care Services. Is that correct? Or they have some type of affiliation?
Some of them are referred from other hospitals such as JPS or Health. Some of them are, because we have contracts with them. We put our community health workers in different places that they can help them as social workers. So some of them are just self-referred, where they just call in and they're not on our services yet. So they definitely have to have a cancer diagnosis in order to talk to me or to see me. But the information that I provide about the education and everything, it's for anybody who has any type of medical condition. So there will be a 5-week series that we'll be putting online, that I'm putting together now, that you can sign up and watch online. And I'll be taking requests to come out and speak and have the 5-week course at different places. So anybody can take that information.
Oh, that's awesome. Okay, so when are you going to start that?
We're in the process of wrapping it up right now. We're just trying to figure out, I'm hoping by the end of the summer that'll be up and running, and we'll be able to have that out for people to just click online. You'll sign up, you'll get a registration, and you can watch everything from your own home.
Oh, that is amazing. Yes, I love it. Love it. Education, knowledge is power.
Yes. Yes, knowledge is power in all sorts. Yes.
So are you guys planning? I know I'm asking a lot of questions about it because I got excited. So are you guys having it like on a weekend, or is it going to be like in an evening, or is it going to be, how can people find out more about it?
Since we're just now coming out of COVID, we're trying to figure out, like, anybody can reach out to me. I have a speaker form online on Cancer Care Services, and you can fill that out and request for me to come out and be a speaker, and I can do it whenever. As long as, you give me enough time, I can set something out and come out and speak. about financial navigation. The 5-week series, if you want it done in person, you'll have to fill out one of those forms too, and we'll work something out on what days work best for you.
Wow, that'd be good for women's group, churches, chambers. I mean, the sky's the limit on that one because everybody needs this type of education. Wow.
Absolutely. I agree.
Yeah. So just a little bit about cancer care services in your own words. What would you say is cancer care services to you?
Cancer care services to me is a center that we've made into a home to provide services for our caregivers, for our patients, and for their families in Tarrant County, where they just, if you need help, we provide it for free, and we're going to walk alongside you to make sure that you have somebody to help you through the journey. Absolutely. That's what cancer care is.
Absolutely. Yes. That's spiritually, financially, you know, educational wise, as far as meds and your disease processes and things like that. So it's a whole conglomerate. I would
yes,
like
it's everything.
You know, it's
absolutely
everything. And that sure does matter. Well, Tamika, thank you so much for your time. This has been amazingly full of information. I think I need to have you back and we need to hone in on a certain subject. But in the meantime, if people wanted to find out more about that upcoming 5-week course, or how many you're going to be doing, or how they can get in touch with you to learn about your other educational opportunities when it comes to financial health literacy, what is the best way for them to reach out to you?
They can find me on cancercareservices.org. That's our website. And they can just click on Financial Advocate, and it'll take you to all of my information. You can send me an email, or you can call the phone number on the page and ask to speak to Tamika, and I'll be there to help you. Awesome. Walk you through it.
Awesome.
We're going to
Yes, you heard it from Tamika Chambers, the best healthcare financial advocate ever.
Thank you. Thank you so much.
Oh, thank you. Thank you. And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities. Tune in next time for another amazing chat and another amazing guest. Thank you.
Thank you.